Morning. Looks as if everything is working. Yep, microphone's on. That's good. Hope everyone's okay. Just going to pop a message in the chat box. Yes, here we are. Good morning, Steph. Good. Right then, let's get going. So last week we started looking at brachial plexus and the origin of it. So we were looking at the roots where they come out of the cervical spine, and that kind of built on the stuff we did when we looked at the neuroanatomy of the cervicals in previous episodes. So if you want a bit more detail around the neck, then go have a look at those. And hopefully, but mind you, but what we did last week should help you. Hi Rahul, nice to see you there as well. Good to see you back. Right, let's get you going. So I'm going to start a little bit back from where we were last time, and then just do a little bit of a recap. So there'll be some things that I gloss over, and that's because we covered them last week. And what we'll do then is build on what we've already done. Okay, so let's just grab my arrow there. So we were looking at this. This is a bit of a recap of the roots and where the origin of the brachial plexus comes from, and indeed any of the peripheral nerves. Obviously this is C6, but it would just be different for each level. So this is it. C6 is cervical vertebra number 6, so they're all numbered. And yeah, the thoracic region is labeled T, the lumbar region is labeled L, sacral region labeled S. Okay, so just to make it easy for us to annotate. So if we're making notes about where we think there may be an issue, then we would use those letters and numbers to in our notes to help us when we're revisiting, retesting things the next time, or passing our notes on to someone else so that they have an idea of what we were looking at. On that though, I mean that just as an aside, I used to do experiments with my university students when I lectured at university, and we would have an ultraviolet pen, and I would mark up around about the level of T4, or certainly what I thought was T4, and then on a student's back on their spinous process on my own, so nobody else could see, and then I would then pass that pen on to somebody else, another one of the students. They would then go in the room and they would mark where they think T4 was, and then so on and so on, and we'd keep on doing it until the whole class had done it. And the differences were ridiculous. It was like a good we can't see my bottom hand. That's how far apart they were. So I mean, for me, that there was up at C7, so that what I would class as C7, and then all the way down into the middle lumbars. So that there's some crazy stuff. So if you think about receiving notes from someone and they said, "Oh, we think the problem's at T5," then and then you're palpating and you're thinking there's nothing wrong here. It may be because they have a different T5 to what you think, because the reliability of that palpation is not very good. If you do it and then you do it again, it's very good. So intra-rater reliability, but inter-rater, so me doing it and someone else doing it, it's not that good. So there we go, just an aside. Yeah, these are the bits at the back that we were palpating, the spinous processes, but these are the bits we're interested in today. So this is the spinal cord. These are the little rootlets that come out of the spinal cord and then form either the motor pathway or the sensory pathway for the neurons. So motor neurons come out of the front and come out this way. Sensory neurons go into the back. The front part of the spinal cord is called the ventral part. The back part is called the dorsal. Okay, so there are specific names to the region. And we've got this lump here. See that swelling there? So that is the dorsal root ganglion. So a ganglion is a swelling. Obviously this is near the nerve root and it's dorsal, it's at the back. And in the sensory reception area of the spinal cord, you'll have this increase in sensory neurons, and that's why we've got this bit of a swelling around that area there. When it gets to this section here, that means it's a mixed nerve at that point. Okay, so sensory nerves going in, motor nerves coming out, and then at this point it's a mixed nerve. So when it exits the into the periphery, it's then mixed, and that's what we've been looking at last week. Just as it becomes a mixed nerve, we have an offshoot going towards the back. This is the dorsal ramus, or the back branch. A ramus is a branch, and that will supply the sensation for the skin, in this case around C6, and it will also supply the muscles that are in that region as well, so the paraspinal muscles of that particular level. And then as the nerve emerges around here, this is called the ventral ramus, so the front branch. So this is the front branch, that's the back branch. And this front branch is the bit that then forms or joins to form the brachial plexus. Okay, so just a quick recap on those. Just get rid of that. There we go. So we had to look at the nerves from the roots, and these were nerves that come specifically straight away off of the root. So here's C5, so kind of midway down your, just below midway in your neck, and there's a specific nerve that comes off of that nerve root straight away. So as soon as it emerges from the neck, becomes that mixed nerve, then we've got an offshoot that goes directly to the rhomboids, so minor and major, and the levator scapular muscle, and it will innervate those particular muscles, and it's called the dorsal scapular nerve. So the back shoulder blade. Okay, so dorsal scapular nerve. This is the pathway of it. Okay, and we had a look at a more detailed video of that last week. So have a look at the session we did last week if you want to go into a bit more detail. But you can see the pathway of the nerve, why it innervates the muscles that it does. Okay, but because of that distribution. And then the next one we looked at, which was coming off of the roots, this is the long thoracic nerve, and again we had a look at a detailed video last week. This comes from several roots, so we got C5, C6 and C7, and again immediately as soon as it's coming out of the neck and it's become a mixed nerve, a peripheral nerve, we've then got three of those nerve roots that then join together to form the long thoracic nerve, which is a peripheral nerve, and it goes down to the serratus anterior muscle. And if we have a look here, we've got the pathway more anterior this time. So the dorsal scapula was on the back. This one's more anterior. So the long thoracic comes down in front of the ribs here, underneath the collarbone, so underneath your clavicle, and then down towards where serratus anterior attaches. And then that muscle, we had a look at that last week, where the innervation was. And we, in more detail, we looked at the nerve innervation. And then a previous week, a couple of weeks ago, we looked at the attachments of that muscle and the actions of that muscle as well. So again, have a look back over those videos if you want a bit more detail to the muscles and the nerve. So that's kind of where we finished up last time. So those were the nerves from the roots. And then the next section along are the trunks. And if you remember, it's split. So C5 and C6 joined together to make a Y shape. C7 made an I shape, so just a straight line. And then C8 and T1 joined together to make another Y shape. So the Y here forms the lower trunk from C8 and T1. The middle trunk is from C7. And then the upper trunk is from C5 and C6. All right, so that's where we are right now. So roots are done. Let's have a look at the nerves that come from the trunks. Okay, so on this upper trunk, we've got a nerve that comes off and supplies the muscle that is just underneath your collarbone. And again, we talked about this muscle a few weeks ago. And so if you have a look at muscles of the shoulder girdle, it might be under, I'm pretty sure it is in that section. Then we've got the muscle subclavius, so underneath the clavicle. So it's formed from the upper trunk, and it's from C5 and C6 to the subclavius muscle. Okay, so let's have a look at that one. I think we've got a video of that one. Have we? No, we don't. No, we don't. Just the picture. Okay. So very small nerve coming off of C5 and C6, and the C5 and C6 join together to form the upper trunk. Then we've got subclavius um, innervation coming off of there. Okay, so the subclavius nerve, and then on the upper trunk as well. Now, this is a really interesting one because you can often get injuries to this nerve in various different places that causes an atrophy, so a muscle wastage of some of the rotator cuff muscles. And you might look at someone on their back and you think that there's an obvious asymmetry between the two. And I'm not talking about, you know, that shoulder's slightly higher than that one. I'm talking about the muscle isn't there. Okay, so you palpate the space where the muscle should be, and all you can feel is bone because the muscle's just gone. Okay, and you compare it to the other side where there is a muscle, and it's obvious that that one's still there. And when they try to do the movements that those muscles bring about, there's no contraction underneath your thumb because it's just wasted away. Okay, so this is a nerve called the suprascapular nerve. Again, it comes off of C5 and C6, so these two join together to form that upper trunk, and this supplies your supraspinatus muscle. So this is the spine of your scapula, just here, and again we covered the muscles in detail on the rotator cuff session. And then your supraspinous fossa is here, and that's where your supraspinatus muscle attaches into there. Okay, so in this space, that muscle is supplied by this suprascapular nerve. So suprascapular just means superior to the shoulder blade. Okay, so we've got this nerve coming in there, and then what we've got that's really interesting here, can you see how it goes underneath this bit of bone here and then pops out here to supply this area under here? And this is the infraspinous fossa, so where your infraspinatus muscle would be. So this nerve, the suprascapular nerve, supplies both supraspinatus and infraspinatus underneath. Okay, so it supplies both. Now, if you are used to dealing with people who play contact sports, things like rugby especially, because you're going into tackles where you're using your shoulder, you can compress this nerve. And there are also some genetic congenital issues as well with the pathway of the nerve that can cause a compression, and then that's what causes this disappearance of the muscle. So but basically if a muscle isn't being innervated, so there's no neurological supply to it, it can't contract, so then it just starts to waste away. Yeah. So obviously it takes a bit of time for that to happen, but you if there's been an insult to the nerve, the lack of motor response is immediate. Okay, so you won't be able to move that muscle if the damage has been quite severe. So definitely something to look out for if you've seen someone that's been involved in like a heavy tackle in rugby or something like that. So these are the little pathways where it can become trapped, right? So we've got the suprascapular nerve just here, and there's a little notch. You will have never ever noticed it on a shoulder blade before. Let me just grab my shoulder model. It's quite clear on this one. Yeah, it's not very clear on this one either, to be fair. But if you ever get to the labs and have a look, then have a look at this little dip here. Yeah, so that's where the nerve will pass through, and there's this little notch. Yeah, see that little kind of U-shaped notch in the top of the scapula just there? So this is the suprascapular notch. It's where the suprascapular nerve will pass through, and there's a little ligament that goes over the top. Okay, so you can get an entrapment in there, and then that will knock out both supraspinatus and infraspinatus because it's at the point where both pathways pass through there. And then we've got another one around here. So as it loops around the spine of the scapula underneath the acromion just there, we've got this spinoglenoid notch. Okay, so a bit of connective tissue there, and it passes underneath there into infraspinatus. So if there's an issue just here, then it will only affect infraspinatus. If there's an issue here, then it will affect both. And then obviously if you get impacted in the kind of trapezius region, then it will affect both. So it's just something to look out for if you're examining someone's shoulders and having a look for muscle wastage. Okay, so that's the suprascapular nerve. I'm pretty sure we've got yeah, here we go. We do have a video of this one. Okay, let's have a look at this. So suprascapular nerve, superior to the scapula. Just pause that there. So I've included the picture that we've just seen from the PowerPoint and also the map of the brachial plexus just down here, so you can kind of organize everything in your mind. Now, this is it on a cadaver. So we've got the clavicle just here. These are your scalene muscles just here. That's the blood supply. So we were looking at that last week. And then these are the nerves that are coming out of the neck, so the nerve roots. So you can see a Y shape here. So that's your C5 and C6 coming together. Yeah, and then they're starting to come together there. And then when they form the trunk, that's when the suprascapular nerve branches off. So let's have a look at that. And there it is, just underneath there. And I'm just going to pause that there. In fact, I'm just going to rewind a second. There we go. That's a good one. Okay, so you can see C5, C6 there. See where it becomes joined together. So that's this bit here. Yeah, so from the roots into that upper trunk. And then you can just about make out that nerve there as it's being pulled and where it attaches. And then it will come backwards. So this way. And then down onto the top of the scapula. So there it is there. And then that's its pathway. Supplies supraspinatus and infraspinatus. And then through that notch. Yeah, so this is an important entrapment site. And then another one just there as well. So again, just something clinically to look out for. If someone's lost power in supraspinatus, they can't contract it, or infraspinatus, then there may be an issue with the suprascapular nerve. Okay, perfect. Hopefully that's all good. And so now we've got subclavius and suprascapular nerves coming off of the trunks. Now, we've got a specific area now called the posterior cord. And there are a few nerves that come off of that cord, and the easiest way to remember them is via ultra. Okay, and I'll explain this as we go through. So again, tips for exams really to help you remember where things go from and to. So let's have a look at this. If you remember, we had the roots, then they went into trunks, then they went into divisions. So they started to divide off. That was the strike and the spare, if you remember that from last week. Again, if this is the first time you're watching, go back to last week because we explain all that in this on that particular video. And then after the divisions, we've then got cords. So we've got a lateral cord, a posterior cord, and a medial cord. All right. So what we're going to focus on now is the nerves that come off of the posterior cord. And the first one that we're going to have a look at is this one. This is the upper subscapular from C5 and C6, and it innervates subscapularis. So your one of your rotator cuff muscles. And again, we did rotator cuff on a video a few weeks ago, so have a look at that. So this is the pathway of that nerve as best as I could do it on these images. And you can see as it comes down and innervates your subscapularis muscle just here. Okay, so upper subscapular, C5 and C6, subscapularis, or the upper part of subscapularis. Okay, so that's the first nerve we're going to look at on that posterior cord. And I'm wondering if we've got, Yeah, we've got it, but we've got a few nerves together, so I'm going to do a little bit more a second. Here we go. And then the next bit, so this nerve here that we've got the image for is two bits of the subscapular nerve joined together, and you'll notice that there was a branch that came off to this muscle down here, and then another one that's gone to the lower part of the subscapularis as well. And this is the lower subscapular nerve from C5, C6 again. So it innervates the lower part of subscapularis, so this muscle just here. So the previous one, the upper subscapularis, was just the top bit. This lower bit is just the lower bit of that muscle, the lower nerve. And then a branch of this lower nerve also drifts down to teres major, okay, down here. So this image that we've got here is actually two nerves looking like one, okay? So we've got the upper subscapular and lower subscapular on the same image just there, okay? And if you remembered, the acronym to remember was ULTRA. So we've got upper and then lower. So those are your first two bits of your ULTRA. Then we've got this one. This is a big chunky nerve, okay? So we've got the thoracodorsal nerve, which supplies your latissimus dorsi. Huge muscle, okay? Really, really big muscle. C5, 6, 7 contributions from each of those nerve roots coming down. And if you remember, it was ULTRA, so upper subscapular, lower subscapular, and now we've got thoracodorsal. So thorax at the back. Yeah, so thoraco, which is your thorax, dorsum, which is towards the back. And that supplies your lats, right? So it's coming down the side here and then going towards your big lat muscle. And again, we covered the lats a few weeks ago when we were looking at muscles around the shoulder girdle. Okay, cool. Right, I'm going to have a look at all three of those together on this next video. Here we go. So this is upper and lower subscapular and the thoracodorsal nerves all together. Okay, just pause that there. A lot of stuff going on. The good thing is with these videos, obviously with YouTube, you can pause it, you can rewind it, you can watch it as many times as you like. So I'll try and pause it at points as well to make it a bit easier for you. So we've got upper subscapular, lower subscapular just there. So upper portion, lower portion. Yeah, that's what we were just looking at there. And if we have a look here, we've got an upper part of the nerve just there, and then a lower part of the nerve just there. Okay, so you can just about make out the difference in the color of the anatomy in contrast to the muscles. I'm just going to play that through. So there's the lower one, there's the upper one, and that supplies this subscapularis muscle. So one of the big internal rotators and your teres major, sorry. And then this one, this is the big nerve coming down. So this is the one that supplies your latissimus dorsi muscle. There's your lat, huge, huge muscle. Yeah, coming off of that posterior cord, thoracodorsal nerve, all the way down side of the rib cage. Okay, so we can see it here, side of the rib cage coming down, and then that is going to innervate your latissimus dorsi muscle. So all the way along there. Cool. Right, let me just play that through again. So small little muscles, little nerves here, upper and lower. And then you can see that thoracodorsal just there, just behind. So those are your subscapular nerves, teres major and subscapularis. And then there's the thoracodorsal running down there, which supplies your lats. Okay. And again, these are really good ones to have a look for. If you get to the anatomy labs, you can track the pathway of these nerves, and it's yeah, becomes, well, I think it's quite fun. It's trying to find which one's which and tracking them back, because they all look very similar and they're all really close together. So the best thing to do is to get hold of the nerve and then track it back as far as you can. And you go, right, yeah, that's coming off of there, that's coming off of that cord, so it must be this nerve. Okay, so yeah, it's a bit sometimes it's a bit of it's a bit tricky because the nerves are quite close together. But yeah, if you can get clear pathways, then you can find exactly which one's which. So here we go. So we've got lower subscapular, upper subscapular, thoracodorsal. So in terms of ultra, it's U, L, T, and you're thinking, well, where does the R and A come in? It comes in here. So the terminal branches of that posterior cord are your radial and your axillary nerve. So coming off of that posterior cord, you've got upper subscapular, lower subscapular, thoracodorsal, radial, axillary, and that's where your ultra comes in. Okay, so hopefully that will help if anybody's doing assessments, doing any kind of exams. And that's the posterior cord. Okay, hopefully all good with that. Now we're going to have a look at nerves that come off of the medial cord. So we had, if you remember the image, we've got a lateral, posterior, and then medial. So this is going to be nerves that come off more towards the inside of the arm, the medial part of the arm. Okay, so what to remember with this is 3M, right? So if you remember the logo 3M, we've got medial pectoral, medial cutaneous for your arm, and medial cutaneous forearm. So what's the difference between these? Whenever there is cutaneous in a name of a nerve, it means that it's sensory. So what this nerve does, this medial cutaneous for the arm, is it will supply sensation to the skin of the arm for the medial area of the arm. The medial cutaneous forearm will supply sensation to the skin of the medial forearm. Okay, whereas the medial pectoral will be motor for the pectoral muscle. All right, so that's why we've got different names. So let's have a look at these. We've got medial pectoral coming from C8 and T1. So that if you remember the from the roots where it is a Y, C8 and T1 coming together, and then coming along this line to form the medial cord. Medial pectoral nerve from C8 and T1 supplies your pectoralis minor and the major, and it goes through the minor to supply the major. All right, so it's coming off of here, coming down here, and then coming through these muscles to supply both pec minor, pectoralis minor, and pectoralis major. Okay, I think I've got a video just of those. Yeah. Okay, so this is the medial pectoral nerve. Here we go. So again, these are the images that we've just seen. So coming from C8 and T1, so it's a little bit lower down in the brachial plexus, and it's medial because it forms a medial cord. So we're coming down towards the inside of the arm, and again that will give you some clues as to where it's going to end up. So here's your medial cord, just here. That big chunky thing there, that again is not a nerve, that's a blood vessel. Your nerves wrap around the blood vessel in the arm, so you've got what would be the subclavian artery, axillary artery, and then the brachial artery as it passes through. So medial cord is here, so that's what it looks like on the nice clean picture, and then in real life there's your medial cord just there, and it goes through pec minor to pec major. Okay, so we've got a branch coming off of there. Let's just follow this through. So there we go. So there's your medial cord. There's your lateral cord at the top there. And then that there, hopefully, there we go. There's your medial pectoral nerve. So that's that bit there that's just coming off there. Let me just play that again. Okay, so that would be these branches that are coming off here. So you can see it just there. And like I said, it's nerves aren't yellow like they are in the books. Yeah, they're kind of like a translucent sort of colour. And again, in anatomy, we use touch quite a lot. So if you're unsure whether something is a vessel or a nerve, you have a feel of it. And if you felt that there, okay, so if you had a bit of a squeeze of it, you would be able to tell that it was hollow inside. So it's obviously an artery. If it's a vein, then as you feel along, you can feel the valves, and you can palpate those valves. But in a nerve, it just feels the same all the way through. So there's no bumps, there's no hollowness. It's all full, because it's not a tube. Yeah, it's just lots of neurons all together, and yeah, it's quite solid. Okay, it's not like solid as in like hard, but it's very flexible, but there's no give to it. Okay, so it will feel different. So again, if you're trying to differentiate between the structures, then palpation with anatomy is quite useful when you're in the labs. Okay, and then there you go. So that's your medial pectoral nerve. There we go. And then this is a drawing I did a little while ago. Sorry about my handwriting. Handwriting's terrible. And this shows the cutaneous supply, so the skin supply from the various nerve roots. This is different to dermatomes, and we talked about that a few weeks back. Okay, and when we were looking at the neck, we did a whole session on dermatomes and cutaneous fields. So have a look at that. It is a bit different. So here we've got the medial cutaneous nerve of the forearm, so that section there, and then the medial cutaneous nerve of the arm, that section just there. Okay, so this nerve here, so medial cutaneous nerve of the arm, so this branch here, this supplies that red zone there. So if you touch the skin around that area, then the sensation of that touch is picked up by that medial cutaneous nerve of the arm and then sent back to the spinal cord via C81. Okay, so that's that section just there. And then the last M is this one, the medial cutaneous nerve of the forearm. So that's this section just here. Again, C8T1, all right, so that section just there. Medial cutaneous nerve of the forearm, sensation from the skin of the medial forearm. So it's that area there. So your 3M for this medial cord is your medial pectoral nerve for pectoralis major minor, medial cutaneous nerve of the arm, so the skin sensation to the upper part of the arm, and then medial cutaneous nerve of the forearm. Yeah, so that's your 3M for that particular section there. Now, cutaneous nerves are absolutely tiny, so they're not usually shown up on cadaveric specimens, and I don't have any videos of them, unfortunately. You might be able to find some on the net. I'll have a search and I'll put them in our Facebook group if I can find any. Cool. Okay. So then we're nearly there. What time is it? Okay. We might be able to get it all done. You never know. So we've got nerves from the lateral cord now. So we've gone posterior cord, which was ultra, medial cord, which was 3M, and now we're onto this lateral cord, so the outside cord, and that is this bit here, up here. Okay. Now, if you have a look, we've got a supply to muscles that we've already got a supply for. Yeah, so pectoralis major, pectoralis minor, but mainly major, is also innervated by the lateral pectoral nerve. Okay, C5, C6, C7. So we've got two innervations for pectoralis major and pectoralis minor, but obviously major, mainly major on this lateral part just here. And this is the video for that one. Just get rid of those. Here we go. So this is the lateral pectoral nerve. Here we go. So that was the medial cord that we saw before. There's the lateral cord. So that was your medial pectoral nerve. And again, we've already seen that one. And then let's have a look at this one. There's your lateral. Look at that, coming off of that lateral cord just there. So we've got two supplies. So both the medial and lateral pectoral nerve supplies both the pectoralis major and the pectoralis minor, but as I was saying before, the lateral pectoral is mainly major rather than minor, so the medial pectoral is more pectoralis minor. Quite a lot to get your head around that one, saying that one. Okay, I'm just going to rewind it, we'll show that again. Here we go. Okay, so medial pectoral nerve coming off that medial cord. Then we've got the lateral pectoral nerve coming off that lateral cord just there. And they'll go down into the pec major, pec minor muscles. There we go. And that's it. Perfect. There's a stunned silence on the comments. Hopefully everyone's okay. Oh, just move that. There we go. Just lock that in place. Okay. Oh, bear with me a sec. That's just messed everything up. Let's try that one. Sorry, bear with me a second. Let's get rid of those. Okay, there we go. There we go. So now we've done all the little branches that come off of the roots, that come off of the trunks, come off of the cords, and now we're starting to get to the terminal part of the brachial plexus where the branches are coming. Okay, so we've already had a look at it on that posterior cord with the radial and the axillary branches. And those are the names of the nerves that we tend to know. Yeah, so we've got median nerve, radial nerve, axillary nerve, ulnar nerve, musculocutaneous. Okay. Morning, Mo. Morning. So yes, I think so, Steph. Yeah, yeah. I tell you what, it's not easy to learn this stuff. If it was easy, then everyone would do it. Yeah, it's not easy. You need to go over it again and again. So now I have a look at the complete brachial plexus, and that just moved me out of the way. Get rid of me. Get rid of me arrow. Okay, so if you want to screenshot that for your revision, if you need it for anything like that, then you can. Okay, and then you got me back. All right, so we've got the roots C5 to T1. These then join together, so Y, I, Y, to then form the trunks. But before we get to the trunks, we've got nerves that come off of the roots, so dorsal scapular, long thoracic. This is towards your rhomboids and your levator scap, and then down towards your serratus. Subclavius muscle, suprascapular, which was towards your supraspinatus and your infraspinatus. That was that one. And then there's nothing that's coming off of these divisions. It just splits. All right. So sections from or parts of this C7 will come up here. Parts from C5, C6 will come down here. Bits of C8, T1 will come to here. Okay. And then they form cords. And the posterior cord was ultra. So U, L, T, radius, axillary. Okay. Coming off of there. Then we had the medial cord, which was the 3M, medial pectoral, and then skin sensation for the upper arm and the forearm, and then the lateral cord over to the pec major, pec minor. Okay, so, and then the last bit to add on the ends is these. Just move me out of the way. So we've got lateral supplying part of the median and the musculocutaneous nerve. The medial cord supplying the other half of the median and the ulnar nerve. And then, just move me out of the way again, the last two branches which you've seen already from the ultra, which is the radial and axillary coming off of that posterior cord. Yeah, so you can see why it's called a plait. Yeah, that's where plexus comes from. It's a plait of nerves all coming together, all sharing off and going off in different directions, and then eventually becoming these branches at the end, so the axillary, radial, musculocutaneous, median and ulnar nerve. Okay, so let's have a look at this. So we looked at this right back at the beginning, and I'm just going to play this through now, and this puts everything together. Okay, so the whole thing. So you've got your roots going underneath your clavicle, underneath your pec minor. So move pec minor out of the way. There's your nerves and your blood supply. So these are the roots, so Y, I, Y. Scalene, move that out of the way. There's your blood vessel there. Anterior scalene, middle and posterior just there. So Y, I, Y, yeah. So that's the Y, there's the I and the Y. That then goes underneath your clavicle. And then we've got the trunks, upper, middle and lower trunks. So there, there and there. Then we've got these divisions. So it's the strike and a spare, as we were saying before. So C8 and T1, that bit there goes posteriorly, that bit there goes anteriorly. So I've tried to put it in different colours, and hopefully this is all starting to make sense now. We're going over it again. Posterior, that one's going anterior. And then in this top area here, we've got a posterior going towards that C7. And then anterior going straight through. Okay, so some are going back, some are coming forward. And there's the whole thing. So there's your divisions where things are starting to join. There we go. And then we've got anterior, posterior, and anterior there, posterior and medial. That's good. So those are your chords. And if you remember, if I just pause that there, so we had ultra coming off of this one, 3M coming off of this one, and then your lateral pectoral coming off of this one. And then right on the end of those, this is where your branches then form. So that's a blood vessel just there. So lateral, posterior, medial. And then there's all your branches. I'll just pause that there. Okay, so musculocutaneous and half of the median coming from this lateral, axillary, radial coming from the posterior, the other half of the median and the ulna coming off of that medial cord just there. And then we end up with the branches. So median in the middle, yeah, just there. There's your musculocutaneous. There's the median, upper part. There's the lower part of it. And then there's the ulnar nerve just there. Okay, so it makes an M shape, yeah, with the median in the middle. So musculocutaneous, median, ulnar. So those are your terminal branches that then go off down the arm. And then lastly, we've got this posterior cord and tucked away behind the blood vessels. There it is there. And then once everything's been removed, we've then got the axillary and the radial, and you can see the differences in size in those as well. We picked up on that last week. So this radial nerve is going to be supplying a lot more muscles than the axillary nerve is, so it's a bit bigger. Okay. And that is your brachial plexus. Just pop that on there, get rid of that. There you go. Hopefully that was useful. Perfect timing, 43 minutes. That's not too bad. So you've got 2 sessions there that go into some real detail for the brachial plexus, and we've got to kind of the armpit area. So what we'll do next week, we're going to finish off some of the blood supplies. We'll have a look at the blood, and then we'll start to move down the arm. So we'll go towards the elbow, and then eventually we'll pick up those nerves again. So we'll go through the bones and joints, then the ligaments, then the muscles, then into the nerve supply again, and into the blood supply. And you'll see where they then connect from the shoulder down into the elbow, and then eventually we'll go all the way down into the hands. Then you have that whole pathway all the way through. Okay, cool. Hopefully that was useful. I will see you next Monday, 10 o'clock.